Margaret, you have the floor.
Thank you. Allow me to thank the organizers of this meeting for facilitating my participation to this meeting. I think this is a very good forum to share what we're doing for Africa, and I've actually been asked to present on the East African Community Medicines Registration Harmonization Project, but I think I will not be doing justice. I've just focused on East African Community. Well, actually, we're looking at Africa as a whole. So I'll give some background on what we're doing on the continent, and after that, I'll go specifically into what is happening in East African Community, and then thereafter, I'll give some updates and conclusion. So this is the outline for my presentation. As I said, I will take you through this. And as a way of background, I think for those of you who are not very familiar with Africa, this is a big continent that is composed of 54 member states. And we have 52 republics and 2 kingdoms. And recently we had South Sudan that had just joined. The population is close to 1 billion, and we also have 8 regional economic communities that are responsible for undertaking most of the economic development activities for the continent. And as far as the new partnership for Africa's development is concerned, this is the organization that I work for. And basically, initially, it was a program of the African Union that was mandated to advance the economic development agenda for the continent. But of course, recently in 2010, it was actually transformed into an agency with a view to, with a renewed mandate, but also with a view to facilitate and coordinate implementation of programs on the continent through the regional economic communities. We are also responsible for mobilizing the needed resources and partners in support of the development agenda, and also to conduct and coordinate research and knowledge management, while at the same time also coordinate implementation of programs and projects and advocate for the African vision, mission, and core principles and values. Now, the NEPAD agency at the moment is actually coordinating, in collaboration with partners, the so-called African Medicines Regulatory Harmonization Initiative. But this initiative actually is stemmed from the framework, which is the Pharmaceutical Manufacturing Plan for Africa, which was endorsed by the African heads of states way back in 2005. But of course, thereafter, the ministers of health on the continent actually endorsed the plan in 2007. And basically, the aim of this PMPA framework is to contribute to a sustainable supply of quality medicines and improve public health and promote industrial and economic development agenda for the continent. So what we undertook to do was to look into the critical factor that would facilitate production, promotion of local production of pharmaceuticals on the continent, and therefore the African Regulatory Harmonization Initiative came about. And basically the aim was to provide sound regulatory environment for manufacturers to be able to actually comply to the standards, but also be able to actually trade across the countries, across the continent, but also be able to trade outside the continent. So that is the genesis of the AMRH. Now, our vision is to see to it that African people have access to essential medical products and technologies. And our mission is to provide leadership in creating an enabling regulatory environment for pharmaceutical sector development in Africa. And we're doing this through these 4 strategic directions. One is on policy and regulatory reforms, whereby we're trying to advocate for increased use of harmonized policies and regulatory frameworks across the member states on the continent. The second one is on regulatory capacity development, with a view to ensure that we utilize the existing institutions in order to build regulatory capacity and in the end have sustainable training programs to promote and produce more regulatory workforce for the continent. We also have a responsibility and a direction that speaks to knowledge management. And basically here, we are actually embarking on a program to establish community of practice so that regulators are able to share knowledge and skills in regulatory science, but also establish some networks that will assist in really sharing the knowledge that they have in this area. But more importantly is a new kind of forum that we want to establish, and this is to have a forum where you have regulators, industry, research organizations coming together through a scientific conference to discuss issues of common interest. And actually we are planning to have our first biennial conference end of this year, and this we're organizing with the partners. But of course, fourthly is to provide an enabling environment for the initiative itself. And here we are trying to look into the possibility of creating a platform of partnerships and have some accountability framework embedded into it, because we see that there's quite a number of players that are investing in regulatory initiative on the continent, but the coordination, I think, is an issue that is becoming a big challenge. So we're trying to establish this partnership, but also be able to have some mechanisms for evaluating and monitoring impact of these regulatory initiatives on the continent. So this is a consortium that was created way back in 2009 with a view to advance the regulatory harmonization agenda for the continent. We have financing institutions, we have the Gates Foundation, we have DFID, but also we have the World Bank that is actually now responsible for overseeing the multi-donor trust fund that has been established as a way of managing the fund under the initiative. A lot of consultations were conducted since then, including the regional economic communities and regulators on the continent, to really agree on how best we can advance this agenda. And what came out as a common consensus was that because we know the challenges that the regulators are facing on the continent, the best would be to identify priority areas on this and focus on that before we move into various regulatory functions. So we decided to focus on registration of medicines and to see to it that regional economic communities undertake to harmonize the registration requirements and standards. So the approach we're taking is to use the existing regional efforts, political mandates and plan. As I said, registration is a pathfinder with a view that slowly we shall get into other regulatory functions and products, but of course with the aim of ensuring that we improve public health, but also contribute to economic development for the continent. This is what we want to see, from the situation that we are in today, where you have 54 national regulatory agencies working independently, and with lack of or inadequate medicines policies and laws, with regulators' capacity being very variable on the continent, different requirements and formats, minimal transparency, no clear timelines, with very little use of reference evaluations conducted by other stringent NMRAs. And we want to change the situation to the point whereby we shall have at least 5 to 7 regional economic blocks working together, and being able to really push forward the harmonization of policies and laws and building stronger institutional regulatory capacity. But more importantly, to have single set of requirements, clear guidelines, fewer dossiers for manufacturers to submit. But more importantly also is to have transparent regulatory processes with clear timelines. And the idea is that in the end, we should be able to ensure that there is pooling of resources and a lot of sharing of information among the regulators on the continent. So we have key areas. This is the situation that we are trying, it's a continuum that we're trying to really facilitate, where you have countries operating independently, but at the moment we are saying that those regions that are ready, then they should have at least some guidelines, from harmonization, that is starting from registration, GMP inspection, producing standard operating procedures, and inspection procedures, and be able to come to a point where they can do joint evaluations and inspections, sharing assessment reports. Also, we're embedding a component of building a quality management system as a way of really investing on ensuring that in the end they have robust registration system. And of course, by doing that, also we want to invest on the information management system, which is lacking in the majority of the African regulators. But of course, in long term, we want to see centralized registration procedures that will happen through the existing regional blocks. But I think one thing to note here is the fact that already there are some regions that are planning to have regional medicines agencies, for example, East African Community, and we really want to promote that so that in the end, we have such systems on the continent. But I think what is very important is that sovereignty of the countries has to be respected all along in the process.
2 minutes.
So as I said, regulatory capacity building is another thing, and another one is the policy and regulatory reforms. But I think now I should focus on the East African Community. What have we been able to do so far, and where we are with the region? And East African Community actually is a regional bloc that has 5 member states with a lot of similarities. You have a population of 133 million, and that is the demographics there. But what is very important is that they have a treaty that is actually providing for regional cooperation among the partner states in the various sectors, including health. And there has been some various decisions that have been made in the region that has actually facilitated the harmonization process. And a lot of decisions were made by the Council of Ministers to the extent that the regulatory agencies were able to sit together and come up with a project proposal for harmonizing registration of medicine in the region. And in terms of progress, I think I should just go straight into what has been done so far, because after a long process of consultation among the member states, regulatory agencies, the industry, and policymakers, they have been able to establish, first of all, a governance structure to oversee the implementation of the project. So there's a project steering committee that has been established, and also technical working groups that are now actually up and running. The project was actually launched last year in March, and 2 meetings have already been held by the steering committee to oversee implementation of the various activities under the project. We've had technical working groups already implementing some activities, and actually different countries were assigned different responsibilities. For example, the technical working group on registration of medicine was assigned to Tanzania as lead and supported by Burundi. And these are the milestones. So far, they've been able to draft quite a number of guidelines for registration, of medicines, guidelines for patient information leaflet for medicinal products, and guidelines and format and content of summary of product characteristics, and quite a number of stability guidelines have already been drafted. And the idea is that by end of this year, we should have at least some consultations with the stakeholders to endorse the guidelines before we go into the next step of implementation. Another technical working group on GMP, this is led by Uganda with the support from Rwanda, and quite a number of documents have been drafted to that effect. The third one is the technical working group on information management system, which is led by Rwanda, and quite a number of activities actually being undertaken in that area. And the last technical working group is on quality management system, whereby Kenya is actually taking lead in that. And so basically, that is where we are in terms of implementation of the project under the East African Community. And I think what I would want to say at this point in time is to say, there is something happening in East African Community. There are some activities that are happening on the continent, including establishing governance structure. We have the advisory committee, which is actually sitting at the, with the secretariat at the NEPAD agency, and we're responsible for coordination and political advocacy. We also have technical working groups that are overseeing the continental sort of implementation of the initiative. We have technical working group on regulatory capacity development, and also another one on medicines policy and regulatory reforms. And I must mention here that last year in July, the African Union Assembly made a decision and endorsed a roadmap for shared responsibility and global solidarity for AIDS, TB, and malaria response in Africa. And one of the key pillars in that is the emphasis on the need to accelerate and strengthen regional medicines regulatory harmonization initiatives, but more importantly is laying the foundation for a single African medicines agency. Another critical milestone that I should also mention here is the drafting of the model law that is now being carried out by the Pan-African Parliament in collaboration with the NEPAD agency and African Union Commission, which we hope that by end of this year, it will be endorsed by the stakeholders. So in a nutshell, I think that is the end of my presentation. And in conclusion, I would say that this initiative is really a strategic initiative for pharmaceutical sector development in Africa. We have so far been able to get a strong political constituency of partnership, not only on the continent, but also internationally. But more importantly is the fact that for this initiative to succeed, cooperation, collaboration, and commitment by stakeholders is very key. And we are taking East African community as a model to be able to replicate to the rest of the African countries. I should thank you for your attention.